Welcome to Skin to It. I am Marlo Sutton, fashion stylist and beauty enthusiast.
And I'm Dr. Sandy Skotnicki, board certified dermatologist. So today we're talking about a very exciting topic, nails. Nails 101.
Nails.
And I like these 101 episodes. I think they're great. I've actually had patients comment, say, I love the 101s because I come away, I go to the grocery store, I go on a walk, and I learn the basics without having to read and getting much more information than a 1-minute TikTok.
Oh, absolutely. Absolutely. Okay, so I mean, I guess I sort of know this, but can you explain what nails are and why we have them? Let's start with that.
Well, think about if you didn't have nails. It'd be pretty painful, some of the things. They really are, it's probably an evolutionary thing just to protect them.
Yeah.
Because they're so, I mean, I've lost a nail before. I've lost a toenail from a marathon. And so, it hurts because
she lost a toe from a marathon.
Not a toenail.
Toenail, sorry.
Hopefully not my toe.
No, losing toes.
Felt like it, but it didn't. So they're made of keratin. So keratin is actually the building block of our hair. It's the outer part of our skin. And the rhino horn?
Like the animal,
That's keratin.
Okay.
It's not bone.
Oh, it's so interesting.
So when you have keratin that's stacked on top of each other and it's kind of stuck and the water goes away, it can be really, really hard. Okay. So I think it was just probably an evolutionary thing that we developed to protect they're very sensitive, the tips of our. We also have a ton of nerve endings. But think about touch, right?
Okay.
So they're
like if we didn't have the nail.
Yeah, it would hurt. It would hurt a lot. So they protect.
Okay.
Help with grip. Yeah.
So it's like hard hair.
Pretty much. Yeah.
Okay.
Yep. And then the growth. So that little white area at the start of the nail.
Yeah.
Call it the lunula. That's the matrix. So we kind of have this it's a stem cell. So it's a factory. So it continues to produce a new nail. That's why they grow continually.
So they produce the keratin.
They produce the keratin. They produce the nail plate. And they keep growing after you pass away for a while. It's kind of gross, but it happens.
Yeah, but it's
a stem cell. Your hair and your nails grow a little bit still because there's stem cells.
Oh, that's so interesting. Yeah. And I didn't know it was called,
lunula.
Lunula.
Yeah.
That's quite pretty, actually.
Moon-shaped.
Yeah, because it is moon-shaped, right? So how long does it take for a nail to grow?
So if you lose your fingernail, it takes about 6 months. And, it varies in different people. And if you lose your toenail, that's the real drag. Like it's a whole year for it to grow back.
Okay.
So that's kind of not a lot of fun.
Yeah.
And I remember, go ahead.
Oh, no. I guess, so when we were talking about this episode, I've never have trouble growing out my nails really long. I mean, I wear polish to protect them. But some people can just grow these like crazy long nails.
And I had to actually read up on that because we did when we were prepping for this. It's genetic. So it's the same thing. Like, why can some people grow really long hair?
Yeah.
Why do people go gray early? All of it's genetically encoded. So when you're born, the size of your that little white area, the matrix, is going to determine how wide your nail is, how long it can grow.
Oh, that's so cool.
There is a health aspect, which we're going to get into a little bit with brittle nails, etc. But the majority of, like for you, I'm the same way. I can't grow. Actually, I can grow pretty long nails it's genetic.
Yeah,
it's genetic.
Yeah. I don't know.
And actually, a few things. The nail grows faster in kids, slows down as you age.
Oh, interesting.
Menopause can also slow it. High estrogen levels can increase it. So pregnancy, you often grow longer nails.
And longer hair.
The middle finger tends to grow faster. Maybe that's
well.
So maybe
that
a
makes
reason.
Total sense, Sandy.
Maybe a reason for that. Yeah.
Okay. So I was like I was saying, I sort of attribute the fact that my nails don't grow long is because they can get thinned out and kind of brittle.
That's different. So that's kind of brittle nail syndrome, which is a syndrome, which I think we're sort of chatting about now. So brittle nails and white spots.
Yeah.
So do you know what causes white spots? Because there's a myth about that.
Yeah, that it's like you don't have enough calcium or something like that.
Totally wrong.
Okay.
Yeah, so that's a myth buster. So if you think again about the matrix, so think of that's a little factory, right?
Yeah.
So if you hurt the matrix, like let's say you stub your nail, you bang it or whatever, you kind of, the factory's going, ugh, and it doesn't pump out the nail so well, so you get a little white mark.
Okay.
So it's usually they're trauma induced.
It's
not about calcium. It's not about health.
Okay.
And then the brittleness is really, it's water, it's detergent. It's, so like if you think about your hair, what dries it out? Too much water, too much heat, too much detergent. It's the same thing with your nails. So a lot of people, especially if they're in an occupation where they're hand washing a lot, they get brittle nail syndrome.
So, it's interesting. When you go and you get a manicure and they have you soak your nails.
Yeah.
I always thought I read that was wrong.
Well, again,
if you're soaking it for a couple minutes.
Everything in moderation. Yeah. And the reason they do that is they can cut the cuticle easier, which
soften the cuticle.
But
we shouldn't do that.
Shouldn't do that.
No.
Yeah. The cuticle is
you have
there.
To explain why.
Why do you think the cuticle's there?
Well, to protect from your finger, right? Like
so actually, it's kind of like a seal. So it kind of think of it as it's a piece of skin that sort of sticks onto the nail, so prevents things from getting under there and getting in. That's when you can get infections. So you don't want to overly, like a little bit of trimming here and there. Listen, I'm guilty of it too, but I sort of tell them to lay off that.
Oh, I always say, I'm like, no more. Yeah. And is it true that when they cut too much, it goes back? Like
that's a fallacy.
Oh, that's okay.
It's like when you cut the hair on your face. I mean, you can't grow new follicles. You're born with your follicles every centimeter or every couple of millimeters. I mean, you're not going to grow more. What happens is the hair gets stiffer. Same thing with it might get a little bit when it's growing out, it might feel more ragged or something, but no, you're not growing more skin.
Not more skin. Okay. Thank you. So too much water. I mean, that sort of makes sense. Just
wear gloves. Wear gloves for dishes. When your hands don't have to be in water, wear gloves. I mean, it's just better for your nails, better for your skin.
Okay. Kind of makes sense. Just like taking that super hot shower and it just dries you out. Right?
Exactly. Exactly.
Although it feels really nice. Okay. So now this is like super exciting. Here we go. Let's talk about fungus.
Yeah, I know.
Fungal.
It's a really sexy
sexy.
episode. Sexy episode. Well, I mean, okay, dude.
Like what makes people come and visit?
I got some stats for you.
And visit you.
60% of all nail-related visits in dermatology clinics across North America are for fungus.
Wow.
And it affects about 13.8% of adults in North America. I always tell people, like, listen, look to the right. If someone comes in with nail fungus, I say, look to the left, look to the right. Someone's going to have, in your friend group, someone's going to have fungus. It's super common. I have some right now on my toenail. I could care less. It's just, and we can get to that. But where does it come from? I mean, there are soil-derived forms of, and the organism is called a dermatophyte for any of those really interested in the fungal aspect, the science. But most of the time, you're going to get it up from public places and from person-to-person spread. So gyms, pools. I mean, even go to your friend's cottage or something. Saunas, hot tubs. Because moisture, the fungus likes moisture. Yeah. And so you're going to pick it up in those locations.
So wear your flip-flops.
Yeah, wear your flip-flops.
You're going to go to a public pool.
Yeah.
Okay.
And actually, a good point there is... I just remembered this. This is really genius, actually. I tell people...
She's such a genius.
Like, let's say you're Taekwondo.
Okay.
Or you got to have bare feet. You can't wear flip-flops in those areas.
Fair.
So when you're finished your class, you take a hand sanitizer.
Yeah.
You sanitize your feet.
Okay.
Or you take one of those wipes.
Like a wipe.
And you wipe your feet.
Huh.
So why wouldn't you do that with your feet if you do it with your hands? So for all those people who do those kinds of extracurricular activities, good tip from Dr. Sandy.
She's full of good tips here. So, okay, let's talk about what it looks like if you do have an infection so that people know what to look for and what they
because other things can look like fungus, but the majority of the time it's going to be fungus. The other common thing is psoriasis that looks like this. So essentially there's a few things. The nail starts to lift off.
Right.
So the fungus gets under there, it starts growing. So you get sort of debris under the nail. Nail can look a little yellowish. It lifts off. We call that onychotillomania. And sometimes it can hurt. And then as the infection gets worse, the nail can get all crumbly and yellow, and it's not so nice. But the majority of people have very minor, like myself, I have minor infection, and I don't really worry too much about it. Okay. The other thing that can look like that is psoriasis, and it's almost impossible to tell the difference. Psoriasis is a condition where you get chronic inflammatory red rashes, elbows, knees, scalps, and some people with that have pits in their nails, so we look for that. But if they don't have that, it can be difficult to tell the difference. The only way to determine it is to take a culture. So I want to make a point here. Have you ever had a toenail culture?
No.
So unfortunately, most physicians do it wrong. They take a nail clipping.
Okay.
You want the junk under the nail. You don't want the nail.
Okay.
Because that's where the
kind of
fungus is. Yeah. And it has to then go into a little, gets plated out and it grows. There's also ways we can look under the microscope. But I mean, a lot of times we get false negatives, which in medicine means there is something there, but it just didn't show up on the test.
Okay.
So it's kind of a bit of it's a pain. And I often treat patients, even if their cultures are negative, if they really want to, with under the understanding and the consent from the patient that we might not be treating fungus.
Right. Yeah. So it's interesting. You just said you have a little bit of it, let's say on your toenail, and you're just kind of letting it be. So, if it doesn't look nice, but it's not really bothering you, is there some over-the-counter things we can do? And what is going to make you actually come to the dermatologist or to your family physician?
Well, a lot of people really don't like to have any issues with their nails. So even if they have minor infection.
As soon as you say the word infection, you just think, well, that's not just going to kind of go away if I leave it.
And actually, that's something we can break down. Is it colonization or it is an infection because it's not supposed to be there. But it's not detrimental to your health. Okay. If you go to third world countries and look at kids running around without shoes on, they all have fungal infections.
Right.
It's not affecting their health. It can cause pain when they get really thick and hard to cut. And I think there's one exception here.
Ingrown
you can get ingrowns. Well, you can. Not so much with the fungus. The ingrown isn't so much with the fungus, but
different problem.
It can be hurt. It can hurt, and so then the nails can get long, and it's hard for older patients from arthritis or something to cut it.
Sure.
So that's when I would recommend chiropody, which is these are people that just tend to nails and put things. But we'll go back to the one exception there where I am a little bit more pushy or aggressive with treatment is patients that are type 1 diabetics.
Okay.
Because we want their feet to be pristine. We don't want any potential injury, trauma, whatever. So sometimes we'll treat them.
Understand that, we're not going to do it.
Because your mom.
Because my mom has. My sister-in-law has type 1 diabetes. My mom has type 2 diabetes. But in a couple of sentences, can you explain why?
Well, because if you have, most diabetes now is so different and it's so much better controlled.
Yeah.
But if you get, there's a risk if you get a cut on your foot. So if you had toenail issues, you might, if they're sharp or something, you might have some trauma. You can get an infection, and the infection can, go really quickly badly, and
because if you have diabetes, you're more susceptible to that type of infection.
If your diabetes is well controlled, then no. So I think diabetes now is a different ballgame. And my mom was type 1 diabetic, and when she had it, her blood sugars were all over the place because we didn't have the monitoring and the different drugs that we do now. But still, it is something. I just wanted to make that point because I don't want somebody coming and say, "Oh, Dr. Skotnicki said you don't have to treat your toenails, and I'm diabetic, and my doctor said you should." So I just wanted to make that point.
No.
And let's talk about therapy. I mean, you sort of already talked about over-the-counter stuff. I'm going to be really straight up here. It just doesn't really work.
Okay.
If you really want to, if you think you have lifting and junk under your nails and it's yellow, go to see your family doctor. Family doctors are very capable of diagnosing and treating as well. There's a prescription topical. It's called Jublia. Is the trade name. Can't remember it's efinaconazole, whatever, is the drug. And it works in people that have very minor infections. Okay. Because it's a topical nail lacquer kind of thing. Yeah. And you have to use it for 6 to 12 months.
Right.
It gets a lot. I actually use it more this is a good tip. So I'll circle back. So the best treatment, if you really want to get rid of toenail fungus, is an oral medication called terbinafine. You have to take it for 6 weeks for the fingernails, 12 weeks or 3 months for the toenails. We have to do a blood test before and after. So that is the definitive treatment. And what I do with the topical sometimes, because I tell people if I give them the oral medication, they can clear up great, but they can get it back again. And some people are just susceptible depending on their extracurricular activities. So then I use the Jublia sometimes as a preventative. So I say put it on the weekends so that this is totally off label. This is just my anecdotal experience to help them prevent getting reinfected after a course of oral terbinafine.
Okay. So that's super helpful.
Yep.
Okay. Can we move on to something like kind of
less non-boring and
less
more
fungal?
sexy?
Less fungal. And it's also something that's completely trending and has been for a little while. We're going to talk about gel nails and shellac. What's the real deal? Should we do it? Should we do it? Good for your health, bad, the UV light, all of that kind of stuff we're going to to talk about. And why is it so? Why are people talking about it so much right now?
Just because shellac kind of just exploded right on the scene. I mean, that was an innovation in nail cosmetics, and it really has changed the game. It's just it's because of that innovation that we're seeing the problem. Okay, so let's talk about. So I think maybe not all the listeners know my academic interest, and one that I publish on is allergy to things that touch us, right? Contact
dermatitis.
Contact dermatitis. So we've seen a huge increase in allergy to methyl methacrylate, a type of methyl methacrylate, which is what they use in biogel nails.
Okay.
In shellac.
Right.
Okay. And
so is it actually in the?
It's in the nail polish.
In the polish.
That's why you have to UV cure it.
UV light.
Right?
Okay.
So if we look at a large European multi-center study, looked that allergy to hydroxyethyl methacrylate, which is called HEMA, which is used in all these products, has increased 117% from 2016 to 2023. Think about that.
Right.
And that's 7 years. It's like, it's gone crazy.
That's huge.
And it's not just, it's actually, it is the people getting the nails, but more commonly it's the technicians. Because I don't know, I do it, we talked about this. I do it periodically.
Yeah.
Like I was away for a month in Rome and I got my little
nails done,
nails done. And but I do it once or twice a year for occasions. But I go in there and I've said multiple times to the technician, I go, you should be wearing gloves.
Sure.
You should have ventilation. You're going to make yourself allergic to this stuff, and then you're not going to be able to do your occupation. And that's what, so 40% of nail technicians in this one study developed allergic contact dermatitis to acrylates within the first 2 years of their profession.
Right. So, yeah. So it's you develop this, you can develop this reaction over time.
Once allergic, always allergic.
Okay.
So you cannot use it anymore.
Right.
And methyl acrylate, there's other acrylates, but they all cross react. So you're out. You're done. You can't do it. And if you get
more shellac.
And if you have shellac, or if you have the acrylate shellac or the biogels on your nails, you're not going to get a rash necessarily around the nail. You're going to get it on the face. Everywhere you touch. Eyelids.
Yes.
Yeah, which is weird, but that's what happens.
But it also makes sense.
Yeah, I mean, it makes sense to you because you've been around me long enough. But for most people, they're like, "Why would I have it on my face? If
right,
it's on my
you think
nails?
that it's going to be around the nail bed or on your nail, but it's actually your face. It's where you touch.
And the European Union, which is so ahead in legislation for cosmetics and personal care products, in 2021 has restricted HEMA-containing products for professional use only, because you can buy this stuff over the counter.
Okay,
like that has this. I think our friend that works with Chanel, there's a Chanel one that has acrylate in it.
Okay.
So it's longer lasting.
Right.
And it cures with the UV, like with normal light.
Okay.
So the EU has restricted that. It's only for professional use, but the outbreak is still, the numbers are still rising. The point here is, again, we're talking about beauty and self-care and fun. Like, I get it done periodically. I know that that's what I do, allergy. But I do it once in a while.
Yeah.
Don't do it all the time. The allergy comes with repeat exposure.
Okay.
The more you do something, the more your body sees it, and the more it could potentially say, I don't like this. And then you're allergic, and then you're out. Can't use it again.
Okay. That makes total sense. That makes total sense. But if you do it once in a while and you're not having any reactions to it, why not?
And the other thing too, which you talked about, is when you take the stuff off, when you take shellac off, your nails are
terrible.
So they're thinner, you rip off some of the plate, and there's this weird condition.
That's why at this point, I did it for some event a little while ago, and then I've just been repeating it because I'm afraid actually to see what's underneath.
You'll take a break and it'll be fine. So that's the point, is take a break. So I didn't know about this. There's if you do it too often, there's this, say this 10 times fast, pterygium inversum unguis.
Pterygium inversum unguis?
Yeah, unguis is Latin for nail. So you actually, this nail starts to stick to the skin underneath, and it's very painful, and it doesn't always go away. So that's rare.
Lovely.
But I think the main point here, listeners, is, do it once in a while, do it for special occasions. Don't do it all the time.
Okay. And the big thing, and this was very controversial, it's the exposure to that UV light.
So very good point. And I wanted to end on that. I reviewed several studies, very large studies. The incidence of skin cancer from UV light doing your nails is really, really, really low.
Really low. Okay.
But listen, I put some sunscreen on. You can get those gloves. I mean, but it's not like there's the fear mongering again, like a 30-second TikTok. Oh, you're going to get a skin cancer. Like it's very rare. Probably the same risk as going down on an airplane. Like I mean, it's just not. It's not. It's fear mongering.
Yeah.
But it is potential.
Okay, wait. Can you maybe reuse? Like, let's find another example of that.
No, but I use that sometimes. I had a patient once.
No, I get it, but maybe like even UV exposure for when you're walking outside and you don't have sunscreen on your hands.
It's higher than that.
Yeah,
it's higher than that. But sometimes these are like it sounds crazy, but I had a patient once with a melanoma. A very thin melanoma, 95 to 99% survival rate. And he was so anxious. He kept coming back and coming back. And I said something similar to that, a statistic. And, he came back to me a year later for his which he was only supposed to come once a year. And he said, I can't tell you how helpful that was to me because it put it in perspective for me because I just couldn't wrap my head around it. But I'm like, I could wrap my head around that.
Okay. Yeah. Right? Yeah. I understand.
So I know it's a bit jarring, but it's the truth.
Yeah.
So,
okay. So that's super interesting and very helpful and just like clear, like that people can understand. People can understand. Do it once in a while if you do. But if you do develop a reaction to it, you can't use it anymore.
No. There's not an acrylate that's going to not cross-react.
Right.
Yeah.
Okay. So let's talk about like painful, like let's say you have painful and swollen areas around the nails. You have ingrown toenails.
Yeah, we're going on to the
now we're back to
the
problems that everyone has, right?
So I mean, the word for that is when you have you pull a hangnail and then it gets all red and sore. That's paronychia. And para is Latin for around.
Okay.
Nychia means nail, so it's an infection around. So
the nail.
One important thing I want to say here is. These are more common in people with wet work, right? Bartender, healthcare worker, or somebody in the food industry, because they're hand washing a lot.
Hand washing all the time, or the hands are in water all the time.
If it happens and it's, it happens, it's really sore. Sure. That's when you're going to use a topical antibiotic because that means it's infected.
Yeah.
Okay.
You use a topical antibiotic if you have an infection, not to prevent an infection.
Good. You're learning.
Of course I am.
So that would be your
season 3 baby.
Yeah, polysporin, or if you have fusidic acid. Yeah. But if it's lasting for months and you have this pain and you have this sort of redness and it's around the nail, it's no longer bacterial.
Okay.
So what happens a lot is people will soak their nails because if it's an acute in medicine means sudden, chronic is lasting for weeks or months. Yeah. It's obvious, but so if you have an acute infection, soaking is actually helpful because that helps with the bacterial, helps decrease the swelling.
Would be soaking in like warm water?
Warm water, yeah. But when you have a chronic paronychia, which I see this happen all the time. I just had a case, like a devastating case. It was a dental hygienist. All of her fingers were swollen and she kept soaking them and she kept having antibiotics. I go, it's a yeast infection.
It becomes yeast infection.
Stop soaking. I gave her an anti-yeast oral medication because she was so bad. She cleared up in 2 weeks and she couldn't work.
Sure.
So that's again my occupational exposure sort of coming in. But just listeners, if you have a chronic paronychia, don't be soaking it and don't be putting polysporin on it. You need an anti-yeast, antifungal.
So then you're seeing your
family doctor
or your derm.
Your derm.
Okay. Yeah. And what about nail picking? Like people who were biting?
There's actually a name for that. What do you think it is?
Well, it's only because it's written on my page here, but can I read it?
Sure.
Onychotillomania?
Yeah. Onychotillomania. Onycho is kind of nail and tillomania is a manic picking. So you can also have trichotillomania, which you pull your hair, your eyelashes, or your eyebrows.
Sure.
Which is an OCD behavior. So yeah, I mean, obviously not a good habit. It's obviously not skin related or nail related. That's anxiety related. And some people, have you ever seen people, they chronically pick their thumb?
Yeah.
The cuticle of their thumb.
Like a tick almost.
Yeah. And then what happens is the nail, in the middle of the nail gets this ridge. We call it median nail dystrophy. And it's
there's like a name for absolutely everything.
There's a name for everything. And they get this ridge. And people come in, I say, oh, you pick your nails. Yeah.
And they're like, how do you know?
How do you know?
How did you, just by looking at me?
So in young people that, not so much with the nail biting, but I mean, you can put, things on that taste bad and all that, but it's usually people grow out of it. I used to bite my nails a little bit in med school. I was stressed out from exams and stuff.
Stress,
but the pulling of the hair and thing is a challenge. And sometimes with kids, we'll put mitts on and stuff like that.
Okay.
But it obviously is more anxiety.
Right.
But, yeah.
Okay, we need to talk about supplements.
Yeah.
And we need to talk about what, if people want to have long, beautiful nails. And there's a lot of advertising out there pushing.
So I did a lot of research on this, and I'm going to actually read some stuff because I think this is a really good part of the episode where I think a lot of people want to know this. So you sort of alluded to it. Your nails don't always grow long. They're brittle. They break. They're whatever. Yeah. So brittle nail syndrome. Okay. So biotin has been shown in numerous studies over the years, sometimes to be helpful, sometimes not. So what's the latest? What's the skinny? The skinny. So current evidence right now is insufficient to broadly recommend biotin for nail health. A 2021 review in the Journal of American Academy of Derm concluded current evidence is insufficient to recommend the use of biotin or zinc supplements in dermatology, not just for nails, but for hair, because we don't have large randomized controlled trials and there's no dosing standard.
Okay.
So anecdotally, in my own practice, I do recommend 2.5 milligrams of biotin for 6 to 12 months for nail splitting and nail thickness. It has been shown in some studies to be helpful. The problem is the dose. Like when you go to the health food store right now, you want to buy biotin, it's in micrograms.
Okay.
2.5 milligrams is a high dose.
Okay.
So you have to take a lot of it, and you have to take it, and you might have to take multiple pills because they come in such low dosing. You can also, some compounding pharmacies will compound a 2.5 milligram tablet for you. You don't need a script. But here's a really important thing here, that if you take really high dose, it can mess up your blood tests for thyroid.
Okay.
And this is really important. So you must tell your physician when you're going for your yearly checkup that you're taking this high dose biotin because your thyroid test might come back irregular.
That's
and it's
so
not
crazy.
From your thyroid. It's from, I don't think we understand how it affects the test, but you can get falsely elevated or decreased results.
So it's falsely elevated.
Or decreased. It says both when I was reviewing.
That is something that people really don't think about.
Supplements are, like meds come from, digoxin.
No,
I think we talked about this. That's a heart medicine. It comes from the flower of foxglove. That's why you don't plant it around your pets.
Okay.
I mean, plants and supplements and things that are in nature, a lot of our meds come from that. So you can't, if you're taking a supplement in a high dose, you need to inform your family physician.
Okay. Because all of our medicine is passed through the liver, right?
So the liver does the majority of the detoxification of meds that you take, and the kidney is the other. Right. Sometimes there's things in the blood that do it as well. But the kidney is the big factory that kind of detoxifies medications that we take or supplements that we take.
Okay.
Yeah.
Okay.
And you have your own story.
Yeah. So I have my story.
I still can't get over this.
Yeah. So a couple years ago, I had a really bad telogen effluvium.
Very good. Hair shedding.
I had a really bad hair shed, and a friend of mine was on Nutrafol, and I started to take it. So it's 4 pills every night.
Well,
I was
we
taking
reviewed it actually in the hair episode, and there was there's some science.
Yeah, there's some science. It's very, very popular. I know a lot of people who I recommended it to because I definitely saw
anecdotal
some regrowth and fullness in my hair. So I went for my yearly checkup, and I got a call back that I did my blood work, that my liver enzyme was slightly elevated, and my doctor sent me to do an ultrasound. And, I was like thinking, so I called them back and I said, the only thing that I've really changed, because I'm on, blood pressure medication and cholesterol medication, but I had added this Nutrafol.
And a high dose, 4 tabs.
4 tabs, yeah. Yep. Well, that's the recommended
It is,
dose,
but it's still,
right?
That's a lot. Yeah.
So, it turned out that the Nutrafol was elevating my liver.
Test.
And it could have damaged my liver. So I stopped taking it right away. The other thing I noticed was, which I should have clued in, was I was getting swelling.
Your legs, yeah.
My legs were swelling. Yeah. My hands were swelling.
Yeah.
But I noticed it really on my legs because I would, and sometimes those things you chalk up to aging.
Yeah.
Right? Like I'd wear like socks. I'm like, oh, this sock is just too tight.
You see the
and
band.
I take the sock off and my like I'd have this really big groove.
So I reviewed that after, so we were preparing for this episode and Marlo was telling the story and I didn't know that. And I felt kind of, because we did recommend it in the hair episode as it's anecdotal supplementation. But I think the point here is that supplements, especially if they're taken in a high dose, or any supplement can have some internal effects. I mean, they are pseudo drugs, but I did review the literature on Nutrafil, and there have been reports of acute liver injury. Yeah. So just be aware.
And I mean, listen, I have another friend who's been on it for longer than I have, and I told her about it, and she's like, I went to my doctor, I told my doctor tested everything, and I'm totally fine.
Yeah, I think it's just that it's the way you metabolize it.
Yeah, but who would have thought? That's the thing.
That's the thing is like as things start to become more popular and used, you start to see, like, look at thalidomide. We use thalidomide for women who are having when you're pregnant and you feel nauseous, and then we realize after the fact that it caused limb deformities in babies. So these things happen with time, right? So supplements. The point is that we're droning on. So the point is that's very scary, and just be careful with biotin and thyroid, and Nutrafil with liver.
Yes. Okay, so now we're going on to also a serious topic, which is nail melanoma. Mm-hmm. I know the answer, but you can get melanoma.
Basically, let's just give it a quick thing. So this is a common referral to the office. If you get a new, dark brown, linear, not horizontal on the nail, stripe, from the cuticle out, it be acromelanoma. Very rare, more common in people of color, Black, Filipino, olive-skinned.
We talked about Bob Marley, right?
Yeah, Bob Marley. Bob Marley died of acromelanoma, acrylontiginous melanoma. And what are the signs? I mean, if you have multiple nails with multiple brown lines, it's not melanoma. I mean, you get these as you get older.
Okay.
So
what don't we get as we get older?
With darker skin. Okay. Right. And if you have one and you're maybe getting another, look at your parents, ask your family members that are older than you, because you get them more as you age.
Okay.
The signs are just like a mole. Like if the band of brown is irregular shaped, has multiple shades of brown. And the real clue for us as derms is when the pigment grows from the nail onto the skin on the cuticle. Okay. That means that's called Hutchinson's sign, and that's something we look for. Okay. I mean, 90% of the time people come in with a band, it's just a benign, we call it melanonychia striata.
Okay.
So it's normal.
Okay.
So, but something to be aware of.
Something to look out for.
Yeah.
And it's something people don't think about, right? Because you don't think you're going to get a mole, like a melanoma.
No, that's true. Not everybody knows you can get a melanoma under the nail. Yeah.
Okay.
Yeah.
Okay. Okay, so are we gonna do a rapid fire with this one?
Do you have rapid fire questions?
I do. Okay. Of course I do.
Go for it.
Okay. So that was super informative. Really, again, interesting. A lot of information there. But we want to do like a rapid fire. So
right. And again, I don't know these.
You do not know these. So definitely Sandy is either going to be skin to it, which means she's going to give it the thumbs up, not skin to it, or we're going to proceed with caution, meaning maybe there's no studies or not enough studies.
Right.
Collagen supplements for nail growth.
Yeah, I mean, I don't know that they've subgroup analysis, like they've done some studies for skin. So, I mean, the nail is an extension of the skin. So it's possible. I think the biotin, as we discussed, is probably, like, if you really want to take the collagen for the skin.
Okay.
Yeah, so proceed with caution.
Proceed with caution there. Using cuticle oil every day.
Yeah, skin to it.
Skin to it. Cutting your cuticles during manicure.
No, non-skin to it. Or proceed with caution. I mean, everything
in moderation.
What about
pushing them back? Pushing back the cuticles.
Proceed with caution.
Okay.
Yeah.
Letting nails breathe between manicures.
The nail's not breathing.
Yeah.
The reason you're doing that is for trauma, alcohol. The alcohol, dehydrates the nail, all that kind of stuff. It's not about breathing. That's just silly.
Okay, so then press on nails. I guess if the nail's not breathing, press on nails.
It's fine, but again, there's glue, so you can become allergic to the cyanoacrylate.
Okay.
I mean, I do that. I have done that periodically for when I don't have time. But again, everything in moderation. There is an allergy risk. It's low. So proceed with caution.
Okay. And these dip powder manicures, maybe we need to know more about that, because I don't know if they use the UV light, but I guess that doesn't really matter. It's still the product.
Proceed
with caution on that one?
So, well, actually, remember in the EU, they've banned home kits with any of that stuff, which I hope will come to North America. So that kind of stuff acrylate should not be used for home use.
Okay. Is it kind of peeling off gel polish instead of removing it properly?
You're just going to increase trauma. So no skin. No skin to it.
And using acetone to remove it. And that's the only way to really get it off.
You don't have a choice.
Yeah.
Proceed with caution.
Electric nail files for gel removal. Again, we're just like
trauma. And actually the airborne thing, like you can become allergic too, and you're breathing that stuff in. So
I know last time, she like did that before. Well, no, like I had the acetone and then the technician used a tool, and I'm thinking, God, neither of us are wearing masks, and it's flying up in the air, all these little particles.
I made my young woman put on a mask, and she actually had a little HVAC thing beside her.
Oh, okay.
So I only go to the places that have that.
Oh, okay. Okay, something to look out for. Nail strengtheners with formaldehyde.
Yeah, they've been around a long time. So you can become allergic to the formaldehyde, but it's very rare. So proceed with caution.
Okay. Acrylic nails. I guess like this is do-it-yourself manicures. Let's just be careful with all this stuff until they ban certain
products.
would
not encourage people to use any kind of acrylic nail product at home on your own.
Right. Okay. And I know the answers to these, but using hand cream daily for nail health.
Skin to it.
Yeah. Using hand sanitizer frequently.
Well, better than hand washing.
You're right.
That's been shown in studies.
Yeah. Wearing gloves for cleaning and dishes.
Absolutely.
Definitely.
And a good brand there is called Bliss Mr. Clean. They're latex free. They're flocked on the inside, soft on the inside, and they're allergen free. Bliss Mr. Clean gloves.
Okay. And then sunscreen on the back of hands for aging. We're going to obviously say Skin to it because we always.
Yep. It's a common area that we miss.
Yeah. Okay.
So I think we
answered all the questions.
Nails 101 is done.
Is a wrap.
Is a wrap.
That was great, Sandy. Thank you. Thank you.
Well, thank you for joining us on Skin to It. Please, if you have any questions, reach out to us on our socials. Don't forget to subscribe and give us a review. It helps us bring you the content that you love.
Yeah.
So
love it.
Till next time on Skin to It. Catch us every Thursday for a fresh exclusive dose of Skin to It. And don't forget to subscribe so you never miss out on the skincare wisdom. We will guide you through the maze of skincare and cut through that noise to help you achieve your healthiest skin. Loving our podcast? Share your thoughts and help us grow by leaving a review on Spotify and Apple Podcasts. Until we meet again, see you soon on Skin to It, your guide to healthy skin.